Hey everyone, good afternoon. This is Pat Ryan. Thank you for taking time to join us for today's update. It should be a relatively quick one, and we are just going to focus on the COVID situation. Unfortunately, the situation has continued to worsen in the last 48 hours since our last update. I think it's very clear now we are well into a second wave of COVID in Ulster County, in the Mid-Hudson region, in New York State, and that second wave is building momentum, and that is very concerning. And I'm going to talk about some of the steps we're taking, additional steps we're taking to blunt that, but really it's going to require every single one of us getting our head back in the game, taking this seriously, and so we'll talk about that as well. Starting with the numbers, just to give the data-driven sense of where we're at. Our total cumulative cases since the beginning of COVID, we are approaching 3,000 cases. We're at 2,933. That's out of just shy of 142,000 tested, 2,346 recovered, and thankfully still at this point holding steady at 98 fatalities. But I'm very concerned with the growing case numbers that lagging indicator of fatalities is almost certain to go up in the coming weeks, and that is just absolutely tragic and heartbreaking, especially as we head into the beginning of the holiday season. That is the last thing that I know any of us want to be reckoning with. Hospitalization numbers that number is holding steady in the last 48 hours. We remain at 14 hospitalized, but you can see the clear trend line up. 2 of those individuals are on the ICU, so that means we have had one come out of ICU. That is one small positive data point there, but this number again continues to slowly tick up, and we expect that it will, as you can see from that forecasted trajectory, that it will continue to go up given the increased caseloads that we're seeing now. Active case graph, this is where one of the places where you can now very clearly and distinctly see the reemergence of the second wave. Remember, this is active cases, meaning the number who currently are positive. So as we're clearing cases and people are recovering, those numbers come off. So this is showing a significant net increase in active cases. To give you a little bit of context, if you rewind back to to Halloween, at the end of October and the beginning of November, about 2 to 3 weeks ago, we were under 250 active cases. So in that time, since that period, since Halloween essentially, we have doubled the number of active cases in a very short amount of time. One of the big drivers of that, as we've been doing our contact tracing and doing these investigations, we believe were social gatherings and get-togethers and parties that occurred during and around that weekend of Halloween, where, of course, we understand that folks wanted to do that, but we're now seeing the consequences of those gatherings and just overall the fact that people have been letting their guard down in social interactions. And it's very predictable that we would now, 2 to 3 weeks later, see these numbers start to really, really tick up and build momentum. Just as an example to illustrate how this works, I'm going to just choose one incident where there was a Halloween get-together of 3 families in the county with about 20 people total that got together. Initially, 4 of them were positive and asymptomatic, so did not realize they were positive. Over the last 2 to 3 weeks, now 15 of those approximately 20 have come back positive. And because of their second and third order contacts and where they work and go to school, we've now had a college in the region impacted with a positive case and 3 different schools, an elementary school, a middle school, and a high school, all impacted with positive cases just from that one gathering where 3 families got together indoors and weren't following the precautions. And if you think about that multiplied across the county on any given day, it's very easy to see how those small decisions by a few folks are exponentially amplified over time and space, and we get to a very concerning situation, which is where we are now. So again, it's important to understand how the decisions that each of us are making are impacting everybody. They're impacting our ability to keep schools open and businesses open, and to keep the economy running, and of course to keep people healthy and safe. Some more numbers and data to illustrate the trends we're seeing. The new positive rate, we'll put up the graph that we always do. This is one of the most concerning 48-hour periods we've had since April. So in the last 48 hours, we have tested 2,165, and had 107 new positive cases in 48 hours. That's a 4.9% new infection rate over a 48-hour period. In the last 24 hours, we have had over 70 new cases in the last 24 hours, and that is 74 to be exact, and that is out of 1,001 tested. So we are now, in the last 24-hour period, over 7% new infection rate. One important caveat on that, though, is that that number of 74 includes a significant batch of tests that were collected over several days and just returned back as a group. So if you think about those, about 50 of them realistically should have been spread out over about the last week, and we got all those results today. So that 74 number in 24 hours is a little bit misleading, but if you blend that over a 48-hour period or over even a 5-day period, we're still seeing very, very elevated levels of new positive cases. The other indicator that I want to talk about, and I know I'm throwing a lot of numbers at you, but I think, as I've always said, it's important to have a data-driven perspective of what's happening. If we can put that graph up again, you'll see that that orange line there, the scale on the right side of the y-axis, which says 7-day moving average of new positives. That's the orange line. What that really means is, in the last 7 days, what's the average number of new positives we're getting each day? That number, the 7-day moving average, is now, you can see that very sharp increase at the far right of the graph. That number is now 33 new cases, meaning that over the last 7 days, if you sort of smooth things out with a 7-day moving average, we experienced a daily average of 33 new cases per day. The last time we were at a number like that was April 4th. April 4th, at the very peak and beginning of the worsening of the first wave. So, and the highest that we ever got, the highest that number ever got at the absolute worst was 48. So we're already at 33, and you can see just in the data and on the graphs that number is building serious momentum and serious speed. And if we don't take dramatic, comprehensive precautions, that it's very possible that this second wave could be worse than the first wave, which is almost unimaginable, but that is real. And as always, I want to be candid and direct with everybody about where we're at. The final graph that I want to show is one that I reintroduced in our Tuesday update. This is essentially showing, this is the cumulative building of positives over time. So when we talk about that we've had a total of almost 3,000 since the beginning. What I really want to draw your attention to is really the steepness of the climb is what we're really looking at here. That steepness very much leveled off after the first wave through the summer and into the early fall, but now you can see it's really steepening again, and we really have 3 different possible projections and trajectories. None of them are great, but the worst case is very steep and would actually be a faster growth rate than we experienced at the worst of this in the first wave. So again, we have control. To a certain degree, we can control our fate and our destiny in terms of how bad the second wave is, but the window to do that is getting tighter and tighter and tighter, and with Thanksgiving coming next week, the timing just could not be worse, where if we don't take that seriously and readjust our plans, it's going to be a very, very ugly December when we see those results come in, and that's just not what I know any of us want. So please, let's continue to use these numbers and what we're seeing as a collective wake-up call and call to action. Hospital capacity, we're holding steady here. As I said, 14 currently in the hospital. We continue to regularly coordinate with our hospital and healthcare leaders to make sure that we have sufficient capacity and need. But again, as a reminder, at the worst of this, going back to April, we were at a point where we were very concerned about our county and regional hospital capacity. We built an overflow medical treatment facility. We were down to 1 ventilator in the county in early April. And if you think about that and recognize that this could potentially be worse, we could be again challenged, as we've seen in other parts of the country, with potential overflow in our hospital and medical facilities if we don't change the trajectory now. Hammering the point, wake up call, wake up call, wake up call, bright blinking red lights. 7.7% 24-hour positivity rate, 489 active cases, and 14 hospitalizations. So what are we going to do about this? In addition to the individual actions that we'll talk about in a moment, I want to make sure that as a county, one of the largest employers and organizations in the county, that we are leading by example in our actions. So I've directed effective Monday that we will essentially tighten back up our protocol and operations as an organization. What that means for our residents is that we will significantly limit access to all of our Ulster County government buildings, with the exception of maintaining some by appointment services for DMV, which we know are critical but do present, of course, some risk. For our own workforce, to protect our workforce and to protect the broader community and population, we are shifting as many of them as we can to remote work. The in-person workforce will be limited very tightly to essential staff only, plus a small percentage of additional support staff. We are going to hold that position starting next week, Thanksgiving week, and we're going to plan to hold that through January 1st. Knowing that this next coming period here through the holidays is shaping up to be quite bad, again, unless we change the trajectory quickly. We have set up and have learned a lot about how to do this, of course, in the first wave, extensive remote work protocols so that we can continue to deliver critical county services to our residents, but make sure that we do it safely for you all, as well as for our staff and our employees and their families and loved ones. So there will be more detailed guidance coming out on that, and if you have any questions about that, you can get them answered with our Recovery Service Center, which we'll share that contact. And thank you, sir. That's up on the screen as well right now. Any questions about our different departments and services, you can always call our Recovery Service Center at 443-8888, and they can make sure that you're getting taken care of. But know that we are open to help, but we're going to do it in a little bit different way and a safer way, like we did during the first wave. And I would strongly encourage every single leader of any business and organization to get together with your team and your staff and think now about what can you do now, right now, to change the risk profile within your office, your place of business. We want to keep businesses open, and we want to try to keep schools open, but the only way we can do that is if we tighten things up again in terms of how we're operating those entities. There are countless locations around the county where you go in now and people are not, they're sitting at a bar or at a table with masks off indoors. And that's that and social gatherings and congregate facilities. Those are really the three vectors driving this increase. So if you're one of those organizations, this is your opportunity to proactively, by your own design, tighten those back up, dig out those plans, those reopening plans that we had during the phased reopening, and let's actually enforce and use those plans. Again, the last thing we want is for someone to be dictating to us how to do this. Let's do it proactively like we did before and do the right things. So we are doing that as a county, and please do that as well with your organizations and your families. Individually, of course, it's the same message, but it's just about taking it seriously and doing it at all times, wearing a mask, maintaining distance, and washing hands. We know so much more now about the science of how this is spread, and we know that in particular, indoor gatherings of any size for an enduring period of time are really one of the most high-risk things to do. So how do you limit those or eliminate those in your day-to-day? I know that's difficult, but that's really what we need to focus on until we get to the point where we have the vaccine widely available. So I know that none of that is what any of us want to hear. It almost physically hurts me to have to share these data points to continue to see these numbers tick up and to have to be the bearer of bad news. But as I've said from the beginning, you're always going to hear it from me and from us straight, informed by the data, informed by the health expertise, informed by what we're seeing, not just here, but in counties around our area, in other parts of New York State, and very much in other parts of the country, especially the Midwest. So please continue to spread the word among your family and friends and loved ones and factor that into your decisions. Please also continue to thank and appreciate all of our frontline workers that have been heroic through the first wave, and that we may likely need to ask to step up again in a bunch of different ways here. We know how exhausted all of us are. I know how exhausted everyone is, especially I think about our nurses and doctors gearing up again in our hospitals. I think about our teachers and educators and staff that have been working now for months to try to make it all work to keep our kids educated, but to also keep them healthy and safe. I think about delivery workers and others who are having to do essential work, but now more and more feeling like that might put themselves or their family at risk. So if not for yourself, think about also wearing masks and doing the things and the precautions that we've asked to honor those folks who may not have a choice about showing up to work, those folks that have to continue to do those essential services, and that if you don't make that right decision, that you could not only hurt yourself and your family, but them, and that we're all intertwined in this. And I'll just end by saying, think back to the worst of this. Yes, it was bad, but also we saw so many moments of selflessness, of compassion and community, of heroism and bravery and disregard for self in order to help others. And that's what I think we all need to try to channel, especially heading into Thanksgiving and the holidays, a period where we should be thankful and appreciative of each other and what we have here. If we can rally that same spirit, and I know we can because we all did it before, if we can rally that same spirit, then we can absolutely get through this, and we can start to flatten that steep incline that we see on all of our graphs. Ulster County is still relatively doing better than others, and that is not an accident, I think. It's because we did really well the first time, and so let's tap that again. Let's get our head back in the game and get our vigilance back up, and we're going to get through this difficult winter. We're going to come out the other side into spring and summer with a vaccine and with a real prospect of eventually getting back to normal. So that is what I know we're all looking towards and aiming for, but know that we have some more tough weeks and months in between. While we navigate those, we are here for you. I am here for you. We are going to figure out how to get some more Q&A dynamic going again as more people are tuning in here. So more to come on that in the coming days in terms of these updates. We'll, of course, keep you updated here. In the meantime, with any questions, we'll put that number up again. Please reach out to the Recovery Service Center, 845-443-8888. I'm encouraged by the fact that we are getting more calls now into the RSC. We are having more people tune into these updates. That means that this is working, that in terms of spreading the word and raising people's awareness. So let's please continue to do that. And let's just please continue to take care of each other and think about everybody. Thank you to the Radio Kingston team and as well to Diana Manuel. Thanks to all of you for tuning in, and we'll see you again for our next scheduled update on Tuesday at 2 p.m. In the meantime, stay safe and healthy and resilient, and we'll see you then.